Welcome to Close Up Radio, where our hosts, Doug Llewellyn and Jim Masters, bring you the amazing stories of people who answered the call to unlock their potential and taken control of their own success with authenticity, creativity, persistence, and resilience. Close Up Radio special guests share their knowledge and wisdom so you, the listener, can live the most empowered life possible. Close Up Radio. And now, here's today's host, Jim Masters.
Thank you very much for joining us, everybody. We're live worldwide on the award-winning Close-Up Radio. Next special guest is Dr. Mandy Patterson, and let me tell you, she's extraordinary at what she does. She's a naturopath and holistic health coach who empowers high-performing women to find optimal health. As an occupational therapist, Dr. Patterson has worked in all sectors of healthcare. This diverse background in conventional medicine speaks to her credibility as a naturopath and functional medicine provider. She saw a real disconnect between our medical care system and meeting patients' needs for preventative medicine. And as the mother of 6 kids herself, one with health challenges since birth, Dr. Patterson could not resign herself to what she saw as a broken system. So she started educating herself through the Institute for Integrative Nutrition, as well as the Institute for Functional Medicine and the School of Applied Functional Medicine as well. Today, Dr. Patterson is bridging the gap between conventional and alternative health. She works primarily with busy, stressed-out moms of multiple children and high-performing professional careers with a special focus on fertility. From a functional perspective, Dr. Patterson believes all health begins in the gut. She can trace almost every single dysfunction or disease back to the gut. It's the modern stresses that we have. It's the unhealthy foods that we're eating. It's the toxins that we're exposed to. And by focusing on imbalances in the body and making lifestyle changes and nutritional changes, we can bring out oneself back to optimal health. She's here to discuss that and so much more here on this episode of Close Up Radio Live. Dr. Patterson, welcome to the program today. It's a pleasure to have you with us.
Hi, Jim. Great to be on here.
Oh, it is great, and I'm looking forward to this conversation, and I've been looking forward to this for a while because I applaud you for the work that you do. I know it's, as you and I were chatting, this is work that is near and dear to your heart. And how did you first, in your own life's journey, really get involved in this kind of work? What were some of those wonderful inspirations that have come your way that really inspired you along the way?
Yeah, absolutely. That's a great question. So my oldest son is now 20 years old, but back when he was born in January of, that would have been 2002, he was born 3 months premature and weighed 1 pound and 14 ounces and ended up being in the NICU for a really long time. It was over 5 months. And during his journey, he had to have multiple bowel surgeries and other surgeries that left him with just a lot of just challenges with digestive specifically. And so when he was a toddler preschooler, he was going to see specialists. We were on that path of seeing many experts in different fields, and they couldn't quite get to the bottom of what his challenges were. And so, we were prescribed medications just like standard protocol in the U.S., and I just really couldn't resign myself to him being on a lifetime of pharmaceuticals. So that's when I went back to school. I actually finished a master's degree in specific focus in neuroscience, and then also kind of kept learning from there, went and did health coaching program and naturopathic doctorate, and then went on to do functional medicine training. And along the way, I kept learning for him and just trying to help him. And so he was certainly one of my inspirations. And then, as you stated, I've worked in all sectors of healthcare as an occupational therapist. from the hospital to assisted living. I've also worked in early intervention in NICU and outpatient rehab. And so have a really diverse background that I really felt disenchanted with our medical system. And I would have patients come in frequently, and I would, help them from a rehabilitation side of things, but it never felt like I could get them fully well, and then they would come back again. And so I really felt like that there was a better way, and whatever that way was, I wanted to be involved in that. So that's a bit about my story.
That's fantastic. It's a beautiful way to be introduced to it. So the work that you do, is really extraordinary, and so much has changed recently in how we're doing a lot of the work these days. Are you doing this virtually now? Tell us about that.
Yeah. So, I do work virtually now. In fact, my husband and I lived abroad in Brisbane, Australia for 2 years. And so when we moved over to Australia in 2017 is when I took my platform online, and it just turned out to be a great thing, especially with, being in a pandemic the last 2 years, and being able to reach more people and for them to be able to find me. So I just found that telehealth has more benefits than not, because people can connect with me all over the world. And, I think also, in a sense, it's calmed people's fears. Like there's more options for them if they can find people that maybe aren't necessarily in their area. And so I feel like that's been a really good thing that's kind of came from the pandemic, is that people have been more empowered to kind of look around and use the internet as a tool to find specific providers that could help them through certain health challenges.
And that's important too, really, because, the most important part is that people need support, and there is a path. They just need someone, to guide them down that path. Tell us about the importance of that.
Yeah, so what I find in my own practice is, many people come to me, they've exhausted all options. They've gone to many conventional providers that haven't been able to get to the root cause of their challenges, and they just feel really frustrated and exhausted by their experience. And so what I've really found, and this is where I really like to wear my coach hat, is that I really just sit and listen and listen to what they've been through. And, many times it's been a long challenge for them, a many year long challenge. And so I think, and I want to say this too, just for all of us as human beings, we just want to be heard. And so like when we have a care provider that can sit down and listen and ask good questions and really dig in to find out where those pain points are, it can make a world of difference in just having that empathy and caring. And so that's where the people that I partner with, I really come alongside of them. I jokingly tell them I'm like going to be their biggest cheerleader because, we all need somebody that will encourage us and motivate us and even be there for us, like in the hard times when, we're making those changes. But, sometimes, with health in general, it's 2 steps forward, 1 step back. And so just having that committed person that can just hear and listen, I feel like it's just so beneficial. And I really think that is the future of medicine, is having healthcare providers that can sit down and talk through challenging things for people. So, yeah, that's what I've learned in my own practice. So,
that's really wonderful. And women, of course, need more support because so much of the information doctors are relying on, I guess, is really based on a lot of research conducted on men over the years.
That is actually true. Yes, in fact, and even in the space of fertility, we find, like even with studies that have been done, evidence-based studies, that, more of it is on men, and men are a bit easier to measure, like even, from biomarkers and such. So that is where, yes, women do definitely need more support. Women are definitely more social creatures too. So, and then too, many times women are not only juggling, busy jobs and careers, but also children, and that falls on them. So, so that's a really good point that you've made.
That's really fascinating, when you really think about all of this. I don't think a lot of people realize that it's been really based on men predominantly over the years. Why doesn't every doctor have someone like you on their staff, Mandy?
Well, I think that the pandemic has been good in that it's really woke a lot of people up. It's for medical care professionals. I was working on the front line of the pandemic when it was going out, and medical providers are just, they don't have enough time in their day. We are ruled by an insurance-based system that's all about productivity and not about the actual quality of the care that is delivered. And so, being a part of the School of Applied Functional Medicine and the Institute of Functional Medicine, that is the overarching vision for the future, is that there will be people and providers that are educated in root cause and functional medicine, and that can partner with other healthcare providers to have a coach in their practice or have access to a coach that can come alongside of them and help them with their patient population. So I do think, a lot of this goes back to even the old days, when you think about, like, my grandfather talks about how, the town doctor would come and do house visits and those kinds of things. And so I think, over the last 100 years, we've kind of gotten away from what is most important. And I do think that, the pandemic has served the purpose in really that kind of call to action. And, like, we're not meeting patients and clients where we should be. And because of that, their care has suffered and people aren't getting what they need. So, and that's why I've partnered with these organizations, because of that much greater vision that, we can do better and we know that there's a better way. And so it's just a matter of scaling it and trying to figure out for medical providers what that looks like in their office, specifically. So
that's important. Yes, that really is absolutely important when you have an opportunity to realize that and implement it in the way that you do, the understanding of all of this. Digestive health is health, of course. They always tell you, go with your gut, pay attention to your gut. And research recently has been really pouring out that what goes on in the gut, in the stomach, in that area, really, really plays a major role in the rest of our overall health. How your stomach feels is how you feel, right? Tell us about that.
Absolutely. So over the years, like, even my own children, I really coach them in that, listening to the important signs that our body tells us. And, when we're ill, that's not a bad thing. It's basically our body telling us it needs something that it's not getting. So, yes, the gut microbiome is just absolutely fascinating. And to your point, research has accelerated over the last 10 years. It's really interesting. And, what we're finding more and more is, our huge portion of our immune system resides in our gut. It's over 75% of our immune system is there. And so it's its own world in and of itself. And so it is a major predictor of overall health and wellness. So, in fact, my doctorate thesis was done on digestive enzymes and the role that enzymes can play in health. And what we found over the years is that by the time we're 30 to 40 years old, we're missing about half of our digestive enzymes. And a huge reason for that is our standard American diet, the amount of stress that we're under as a culture to perform and, produce and all of those things. And so, our gut health is just so important as a sign that, the rest of our body is doing okay. So in my own practice, I do a lot of gut testing and looking at the microbes in the gut, because there's good guys and there can be some not so good guys in there. And when we have an overgrowth or whatever, we can end up with energy issues, or we can end up with hormonal issues. And so I tell, when I'm educating people, it's, you want to have a really good handle on that and understand that, the body is all interconnected. And that's been a problem for years that, we've divided out into subspecialties, but we're not looking at the bigger picture of things to see how, our gut function can impact our thyroid function, and that can impact our hormone function and, all of those things. So, the gut is a very, very fascinating field of science at this point.
Very fascinating indeed, absolutely. And the more we learn, the more we can take care of ourselves in ways that we never thought before. When you are working with a client very first time, take us through that process. Do you do an assessment? How does it work when you're starting with a client, Dr. Patterson?
Yeah, absolutely. Great question, Jim. So typically what I do is I do free discovery calls that are around 30 minutes to an hour with people, just to get a handle on what's going on with them and just to get to know them better. And, that helps direct me to say, okay, yeah, I think that we would be a really good fit. I can help you with this. And, sometimes when I don't feel like it's in my scope of practice, or that I have a colleague that would be better at assessing that, I will give them that referral and say, I think this would be a great practitioner for you. But once we make that decision to work together, I do a comprehensive health history on my patient. It's typically, once we do that, it's about an hour and a half to 2 hours, where we literally go back to their birth and work up to the present and talk through their health challenges over the years. Like we talk about, this is a really interesting thing when you talk about gut health. We talk about, were you born by vaginal delivery or by a cesarean birth? Because that can make a really big difference on a newborn's microbiome initially when they're born. We'll also talk through, were they breastfed or bottle fed? That makes another really big difference. And sometimes as children, we can have been given a lot of antibiotics and those kinds of things. So we talk through those dynamics. I also dig into family history as well, because that is so important. I tell people, genetics, they load the gun, but lifestyle pulls the trigger. In that, our genes don't determine our destiny. There are many, many things that we can do, in taking care of our bodies that can cut down on our cancer risk, that can cut down our cardiovascular risk, and all of those things. So once we do a thorough evaluation, then I set up a health plan with them. We partner together in talking through dietary changes they might make. Sometimes we'll talk about supplements and herbs that could be a benefit to them, that are customized specifically to their unique needs. And, we will also look at other things as far as lifestyle, such as stress management and sleep. Sleep is such an important component of good health. And then I typically, once we get that going, I work with clients in a 3-month coaching partnership, and we meet. It's usually about every other week. And then I also might suggest some other diagnostic testing along the way, or even labs that I can look at to get a handle on other dynamics. So, but that's typically how I do it with clients currently.
That's important. That is so important. How is a person supposed to navigate all this, by themselves?
Yeah, that's a real challenge. I think a lot of times, most people go to their primary care physician once a year. They'll get labs, and they're like, walking through labs, and they're like, oh, these are okay. These labs are all right. Unfortunately, our conventional medicine medical system is set up to be more of a reactive system versus a proactive system. So my lens is a bit different as a functional medicine provider than a conventional provider, in that our lab standard levels are definitely different, because we're looking at more things from a preventative side. So for example, like they will look at your blood sugars over the years, and, they're taught that a certain threshold basically puts you into the pre-diabetes range. Well, as a functional provider, I am definitely looking at that more from an eye of a preventative side, because it's so much more important to do preventative medicine, or it makes it easier to navigate than to be reactive and actually reversing disease dynamics. So that's where going to a functional medicine provider can be really valuable, because they can help you sort out and look through labs and determine, like, oh, well, this might be a little off, or you can tell if there's nutrient deficiencies, for instance. Some people need higher levels of vitamin D or zinc or whatever. So that's where, partnering with somebody that's more holistically focused can be valuable, because they can help you navigate the nuances and those things that you're not necessarily getting from a primary care physician.
That's amazing. It really is amazing, because a lot of times we don't even realize those things. It's fascinating. I was mentioning in the beginning that you're really bridging the gap between conventional and alternative health. That's not that you're saying, conventional medicine doesn't have its merits. Of course it does. But you're bringing in an extra added perspective and understanding through the appreciation of the study of the work that you do, right? The alternative side of things.
Yeah, you're absolutely right. And to your point, conventional medicine has a very important place in our society. In fact, my son, who was born 3 months premature and weighed 1 pound and 14 ounces, had he been born 10 years before that, I honestly don't think he would have survived. So I think that we need, and to your point, it's bridging the two of those, because they're both very valuable tools. And, I jokingly tell people, I'm like, if you're in the middle of a heart attack, I'm not going to be throwing an apple at you. I'm going to be getting you to the closest ER for them to help you. So, and I think that it's more of this team approach in, like, recognizing the value that we each offer. And I think too, conventional medical providers, like when we're trained, we weren't trained about all of the preventative ways, looking at disease and dysfunction and all of those things. And, physicians and primary care providers, including physician assistants and nurse practitioners, they're very, very busy. And like I said, a huge challenge for them is, being in the insurance model system where, they're dictated. They have 10-minute sessions that they can spend with a patient, and there's not very much time for them to cover anything that's not absolutely urgent. So that's where holistic natural, providers can come in and really offer value in helping them. And I work in my own practice with physicians and nurse practitioners and physician assistants all of the time, and will communicate with them on behalf of my patients and, serving in that advocacy role and saying, hey, I don't know if you saw this in the labs, but I did pick up on this and, wanted to see what you think about that. And so it's that collaborative piece that is so, so important and that I am very, very passionate about as a medical care provider, because after working in the hospitals and working in assisted living and all of these sectors of healthcare over the years, really saw such a huge need for this, for somebody that can come in, that can, really bring the different professions together.
And that's important, really, combining it all, the ability to do that. Having the background as an occupational therapist, I think, as well, and having worked in all sectors of healthcare, this diverse background and conventional as well as naturopathic and functional medicine, is really a great advantage, I think, for your clients, because you have an appreciation and understanding of both worlds.
Yeah, that's so true. I think, too, over the years, I was so accustomed to reading standard labs. Like, I knew those things. And so, like, in the rehab side of things, like in the hospital, like, I would always read labs before I would even go in and see a patient. So, like, I had deep insight into this. And then, once I kind of got further training in the functional field and in naturopathic field, I already kind of had that as like a stepping stone to really start to understand even more from a preventative lens what things look like. So yeah, my journey has kind of been long, and I feel like I've kind of gone the long way. And honestly, too, just dealing even with my own family's challenges and my son, who was born early. All of those things have kind of just they're tools in my toolbox that I can use to pull out to say, maybe we should go down this path or this path. And, I think what's so important is just meeting people where they're at. And I tell my clients this all the time. I'm like, that's why I'm working with you. Like, we're partnering on this. This is not me telling you what to do, because that doesn't work as well. It is about a partnership and it is about a collaboration. And so it's about meeting people where they're at. And so, your health journey, Jim, it's very different than my health journey. And things that you can do and change over time, I might be able to do those much more quickly. And so I think it's just about asking really good questions. And we're all on this life journey of we have different challenges that come up from day to day to week to month and year to year in our own lives, and just navigating those and having someone that can just be that sounding board. So
that's so important. It really is. I encourage folks to go to the website mandypatterson.com. That's MandyPatterson.com to connect with Dr. Mandy Patterson. Again, extraordinary what she does. And Dr. Patterson, again, is a naturopath and holistic health coach who empowers high-powered women to find optimal health. But I tell you, a lot of the credible information is really useful for everybody that was listening today. And I learned a lot in chatting with Dr. Patterson, and I'm sure you did as well. And I encourage you, again, to go to MandyPatterson.com to learn more. Dr. Patterson, thanks so much for joining us on Close Up Radio. It was a real pleasure to have you here, and I hope you enjoyed the time with me as much as I have with you, and hope we get a chance to expand and explore some more, maybe hear some case studies, things of that nature down the line. But this was a pleasure. Thanks for joining us.
Thank you so much for inviting me, Jim. It's been great.
You are very welcome. Keep up the extraordinary work, and we look forward to hearing more from you soon. Our very special guest, holistic health coach, Dr. Mandy Patterson, here on Close Up Radio. Jim Masters here, inviting you to stay right there. I'll be back in just a few moments with another amazing guest right here on Close Up Radio. Until then, for all of us, have a terrific day, and bye for now.
You have been listening to a broadcast from Close Up Radio, a division of Close Up Television Incorporated. For more information about our show and to be considered for future broadcasts, please visit closeuptelevision.com. You may also learn about us on social media and listen to us on podcast and internet radio. Thank you for joining us, and we hope that you have an empowered and productive day.